Once you have verified that the settings are appropriate for your needs, you can proceed by creating a new patient. The TRIOS software will prompt you to confirm any changes to the settings. After confirming, you can then proceed to create a new patient by entering their first and last name. In case there are multiple patients with the same first and last name, you can also input their date of birth. For the purposes of this video, we will use a fictitious name. You have the option to save the patient information, or if you are ready to begin scanning, you can instruct the software accordingly. That we need to do a new case. We need to create a new case, and we need to do new scans. The software will then prompt you to specify the recipient for the scans. You have the option to either keep them in-house or send them to a lab, a choice that should be based on the intended use of the scans. In this instance, we'll choose to keep them in-house, as these are the initial scans for 2 study models. It's worth noting that you can always change the recipient of the scans and send them to your laboratory at a later time. Since these scans are intended for study purposes, we will instruct the software accordingly. We don't need to scan a prosthetic abutment or an implant abutment, but we need to get study scans, and then we're going to click on Scan Only. This page, I remind you, represents our prescription, so if we have to send it to the lab, we should fill it properly with all the patient's information, delivery date, and type of material. Still, these are details we will see in the following video tutorials when I will show you how to scan a natural prosthetic or implant-based abutment. Before we start our scan, I advise you to always check the scan tip mirror for scratches or imperfections, because this can affect the quality of the scan. We start scanning from the lower arch as the digital flow of the TRIOS shows us. We start from the posterior area and move the scanner in the vestibulolingual direction to try to scan the lingual and vestibular slopes of the cusps of the posterior areas as much as possible. After reaching the frontal zone, we proceed forward and then move in the vestibulolingual direction, so that the scanner can then properly recognize when we move to the lingual or vestibular side the scanned areas. So as you see, I move the scanner. In the vestibular direction, I turn the scanner to the anterior area. I'll continue in the vestibular area. Maintain a constant, smooth movement and then transition into the lingual area, where already most of the scanning has been done because of that movement I explained at the beginning. At this point, the lower arch is completed. Let's go check it on the screen. Where you see the green areas are the holes mentioned during the initial settings phase. These represent regions the scanner didn't detect properly. It's our decision to determine their importance. Since this is a study impression, the current scan appears to contain all the necessary information. We will crop the vestibular areas of the tissues we're not interested in to obtain a cleaner scan, and will also trim the distal areas. In this case are the third molars that are starting to come out. We also trim the lingual area. We click on the first button on the trim menu, and automatically the scanner will clean the residue that we had trimmed. At this point, we turn the tip to make it easier to scan into the upper arch, so that we have the button. Looking upward, and we proceed to scan the upper arch. The movement should always be the same as I explained before. Also in the anterior area, this little oscillatory movement from vestibular to palatine helps a lot. We go to the contralateral area. We go to scan the lingual palatine area. We rotate the scanner in the lingual area. And if we want to facilitate, for example, scanning in this area, we ask the patient to slightly close the mouth. As you can see, we managed to scan the third molars as well. At this point, we continue vestibular. And when we are in the frontal area, we turn the scanner. Again, we ask the patient to close her mouth slightly and gently close, 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 stay. And again, you see how we managed to get the last tooth better. I would say this is a good scan, except for this anterior area. As you see in this anterior area, just in the cusp area of the incisors, probably the scanner failed to join the buccal area with the palatine area. In this case, my advice is to delete the scan and resume it, because there might be some issues with reconstruction of these areas. So I'm going to use the delete scan function. And I'm going to scan it again. As you can see in this scan, there are no black holes, but rather, green holes in the incisal areas, so the scan is definitely more precise and more accurate. Let's go and clean it up through the trimming function. Also in this scan, as we did with the lower one, we trim all the excess vestibular areas and this palatine area. At this point, we press the first button that goes to eliminate the excesses. We confirm. And we are going to record the occlusion. The TRIOS allows you to record the occlusion. In both the right and left side, it is essential to instruct the patient, even in such a seemingly easy operation, because the patient has to know that he has to remain still, so he has to close the two arches, and she has not to move, although we move the lips and cheeks. So she has to stay close in this position and don't move even if I pull or move it. Verify that the patient doesn't move, because if at the time you record static occlusion, the patient has an imperceptible movement, the bite scan will not be usable. You have heard this noise that tells us that the bite scan has been taken correctly. I, however, prefer to advance slightly so that a larger area of bite scan is recorded. After detecting the occlusion on the right, we proceed in detecting the static occlusion on the left. We move the patient's cheek away. You heard the noise, in this case was immediate, but I continue to detect a larger surface area. The function found in the initial settings for bite scan management, as previously explained, is also available in the scanning screenshot. You can uncheck the contact adjustment option as shown. The bite scan's position can be slightly adjusted or reflagged if needed. These situations should be addressed in collaboration with the dental technician, taking into consideration the clinical context to determine the most suitable adjustment. Another very important function that we have is the ability to check contacts through this clearance function. We change the view and we go to see our occlusal contacts. Clearly the reds represent the occlusal contact points, and we can change the settings of coloration to have more accurate contacts. And as you can see, in this situation, we can really visualize the contact points. One invitation I make to you to check the accuracy and precision of your scanner when you record the occlusion is to take an articulation paper and go and check whether the contacts that the scanner shows you are also visible by checking with the occlusal paper. Once the static occlusion is detected, we are ready to detect. The dynamic occlusion, as you see, the software indicates to you with blue the areas detected with the static occlusion that will be useful to record the dynamic occlusion. Instructing the patient before detecting dynamic occlusion is very important, because the patient needs to understand what movements we need to record. So we explained that the mandible basically moves through three major movements that are the ones that we should go to detect. So the mandible can slide forward, it goes back, it can slide to the right, comes back, and it can slide left and comes back. These are the three movements that we are going to record, and we have to make sure before we start the scan that the patient is able to do it correctly. At this point, as we did for static occlusion, we ask the patient to close their mouth. We put the scanner tip in this area. We start scanning. Well, please slides forward slowly. Slides back. Comes back to home base, slides to right, comes back to home base. And slides to the left. Returns home. The noise, as I told you at the beginning, helps us a lot in understanding that the scanner is working properly and we can focus on what the patients are doing. After the software has post-processed the dynamic occlusion that was just recorded, we go and check that the movements made by the patient have been recorded and post-processed properly. So we check in the different views. After that, if everything is okay, we can move on to the next step. Using with this initial scan that can be used as study scans, we can go back into the patient settings, re-click on the scan we just did, change the initial settings, so from scan only, we indicate to the software that we want to do a simulation of orthodontic treatment. This is the treatment simulation function. This will enable us to demonstrate to the patient, in this specific case, where there is slight crowding of the dental arches, what the proposed orthodontic treatment might entail. Once we change from scan only to treatment simulation, we go and click the function that you see here, TRIOS Treatment Simulator. The scanner and the scanner software starts to check and decide what might be the tooth movements and alignment to be done in the specific patient. In this screenshot, we have a double window. We can have the initial window only. We can have the window after the treatment. Or as we had in the initial stage, the double window, we can view only the upper arch. And then we can present the initial situation to the patient. The software automatically generates a potential alignment, but if we're not satisfied with certain adjustments, we have the option to customize them using this function. We will go to indicate the tooth, and we can change the angulation, rotation, intrusion, tilt. So a whole series of functions. We're going to check the lower arch. The alignment is relatively straightforward, and the software has automatically generated it quite effectively. You can observe the initial crowding and the alignment achieved using the treatment simulation option. In this first video, we covered the basic initial settings for starting with intraoral scanner TRIOS. We demonstrated a very simple initial study scan, which is highly valuable for patient communication, providing information about the patient's occlusion type. Additionally, we explored the treatment simulator function, offering patients an initial understanding of even straightforward orthodontic treatments. In the upcoming videos, we will focus and go deeper into prosthetic aspects, including scan taking for natural abutments and implant abutments with TRIOS intraoral scanner.